BJC has not ventured into that on the inpatient side like we would have liked for a variety of different reasons. And the main reason right now is we had to forego our threshold for meaningful use for 2017 and the first part of 2018 because Horizon Clinicals, which is the application that we have, would not allow or provide for this to be a good, successful implementation. So we forego that, knowing with our plan and mitigation strategy that we put together for CMS was to let them know that this is planned for Epic. So as we roll out Epic to all of our sites, ePrescribe will be one of those. So there's a lot that goes into this particular one, the good, the bad, the ugly, you know, why some physicians use it, why some don't, what are some of the complications about it, making sure you have the right pharmacy listed for the patient. I just got out of a clinical champion meeting with our providers. At Children's, they have some very difficult, or they call them difficult, I would think that they're probably pricey medications that sometimes patients are discharged and have two separate pharmacies that you have to pick up your meds from. So they were questioning the e-prescribe process in general from a provider standpoint to make sure that we've aligned for that. So that's part of the bill. And so actually this project gets you through the entire design, understanding, build of the application, and then the user adoption part where you're actually installing it in the user community, physician community. So you have the nurse, the provider, which is a good combo for Capstone projects. The next one is Marjorie's, the OBIX application, which is interfacing our women in infant model of Epic with the fetal monitoring application. So this is a variety of things. You can look at it in a bunch of different ways. How do you have one integrated application, but you're integrating it with another application? So there's some technical complexities to that in itself. But then also understanding the user adoption piece of that. Why is that important to the nurse? Why is it important to the physician? What are some of the ramifications of that? How does it stand up in the industry? We had GE as our system in the past, which we were getting rid of. We just got it installed. So what does that do to, probably from the IT perspective, we just got it all installed, everybody's supporting it, and now we're ripping it out and throwing it out. What does that do for our clinicians out there? So a lot of different twists and turns you can make for many of these. Next one is ED and women and impacts with the Sorian. So we have an integrated application, one of the only ones across the country that are going to be interfacing to a different revenue cycle system in Epic. So if you're interested in revenue cycle side, that might be one of interest. It's very complicated. It also has a big IT piece to it that if you're interested in those kinds of projects. Some of the other ones, I won't go into all of these, but number 5, the mobile technology is a big deal. And how do you implement mobile technology with the clinicians? Many of our youngsters coming out of school, that's all they know is this, but not all clinicians are familiar with this. So how does that play into the day-to-day workflows of a nurse? And how do you implement technology in the clinical setting and still be successful? So wireless technology, mobile technology, lots of exciting new features coming with that one. Same with the next one with this same thing, but medical devices. So in the ICU, Epic links you directly into the monitor device that you're hooked up to. All of the data coming out of the monitor device dumps into Epic, and so you don't have to do additional documentation. So that can be a clinical as well as a technical kind of review of that. Number 7 is probably just if you're really interested in just really getting into informatics. BJC has never been fond of allowing other vendors to host their data. It's our data. We're very protective of our data. It's always been in the world of BJC, and this is the first time we are actually having Epic host our data center. Well, what does that mean for backup, and what do some of the physicians say about that? So this is actually a really good one for voice of the customer. If you go out and interview some of the clinicians, when you talk about having your data center up in Verona, Wisconsin, which is cold and snowy and, oh my gosh, you might lose power. How does that make the clinician at the bedside feel when they're hosting our application? So that's kind of a technical. You already mentioned 9 is the Pyxis. So what happens when we have a new strategy, we got all of our hospitals on, we now have 12 hospitals with Memorial. They don't have Pyxis. They have Omnicell. So how do you do 2? And how does that work in your mix when you're talking from a pharmacy perspective? So there are lots of pharmacy-specific practices that play into this, as well as just some workflows in the pharmacy area that need to be well understood. Change management. I know it sounds like a word that everybody hears all the time, but what does change management really mean? And to us, it means when you're implementing Epic, you have to touch the lives of every clinician. So right now, we're 31,000 individuals that we're training. So we are going to be changing the life of every clinician within BJC and WashU, whether it's in their practices, whether it's in the examples that I just mentioned above. But how do you tackle change management? And that's more of a process improvement piece. If you're interested in moving into nursing informatics or clinical informatics, what does that whole profession look like? How do you get there? What do you do? What does it look like afterwards? Just the industry in general, what it was, what it came to, why is it so important now versus a couple years ago? What has changed? So there's a lot of history behind that, and a lot of hospitals across the country are out there on the sites that you can kind of talk to, a lot of different partners out there, understanding what the significance of clinical informatics or nursing informatics, whatever you want to call it. Why are hospitals going to get a CMIO and a CNIO now when clinical informatics has been important for many, many years? Why is it so important now? So BJC, for example, just hired last year, 2016, the first CMIO, Dr. Welchie, and they just hired their first CNIO, which is Terry Bryant, to fill this gap of clinical informatics. So it's kind of a neat profession, and lots behind that one. Let's see, training is always a big deal. Rhonda can vouch for that one. So what goes into training when you're talking about a new EMR, or just when you're talking about training an end user in general? What are some of the things that you have to keep in mind when you're up there standing and doing delivery versus what's the future of training when we're looking at virtual training classrooms? For BJC, bringing everybody to a location to do classroom training is pretty horrific, especially from Parkland. We're asking you to, well, we're not going to really ask you to come here, but we're going to come to you. But truly, a lot of hospitals, including Sutter Health, have tried to figure this out differently. So once we go live and we have new employees coming on board and need to be trained in pharmacy or nursing or wherever, how do we do a better job of training them when we have all these hospitals so geographically disparate? How do you bring them all together and have a training classroom? And there's a lot of new technology out there that will allow that, so you don't have to have that one person standing in front of you doing all the training. So lots to that one. Physician utilization, so interesting for providers in general. How are providers adapting as soon as I feel like we've passed the gap of they're finally on board with electronic medical records? You get something like MD Anderson that pops up and they just laid off 600 individuals from their program, blaming it on Epic. They recently went live. Why did that happen? And the providers always seem to have a different taint of the story than non-providers. So when I talk about providers, I'm talking about physicians. So it's the physician world and how they view things versus the non-providers. And they're two totally different worlds. And so when you're doing training, when you're doing implementation, when you're standing up just user adoption pieces to try to get people ready for that, you have to have two totally different lenses on at all times, because the same program doesn't work for both parties. And there's a lot of history behind that one as well. It's kind of interesting, actually. Command center planning. What is it going to look like when we are bringing up all these hospitals on Epic? How do you support this and go live? You know, what does that command center and role look like, and what are all the other roles within the hospital, and how do we really support each other at a time of go live. Regulatory requirements, there's a lot of them. Those, the only thing I caution you on those, if that's an area of interest, there's a lot of changes going on, and there's a lot of moving parts, so you could easily get into it, and the day you publish your paper, it's different. But that's kind of almost with everything. But there's a lot of interesting changes going on just in the regulatory realm, because meaningful use came in to try to get everybody focused on the electronic medical record. That's really the main focus of that, and to try to get everybody on that stage 7 path that we were marching to. But found out from a lot of rebellion across the country from a lot of the hospitals to get incentive for meaningful use. It was, I don't want to say it wasn't that easy, it certainly wasn't easy, but the prep that went into it, it sort of depended on a lot of different factors that they didn't realize when they were putting the regulatory requirement together. So there's a lot of pieces in that that's more interesting. Infection control, that's another newer area. Not that they haven't ever had electronic medical record stuff or systems, but the antimicrobial stewardship also from the pharmacy folks in here. That's sort of a new area in the EMR that lends itself well to some new advances where you can kind of track things in advance, making sure you have the right medications hooked up, as well with the infection control physicians who have ventured into more of the clinical informatics side of life. Like Dr. Rochi and Dr. Clay Dunnigan and Dr. Bruce Hall and several others that live in the Center for Clinical Excellence. They're very interesting to talk to and learn from, so that's one area there. And I guess the last one, like I said, I wasn't going to go through all of them, some are pretty self-explanatory, but the last one being the patient portal. Up until now, it's been working with the hospital, working with the BJC Medical Group, and the push, and even pushing it from the meaningful use perspective, was really pushing it to the patient in the community. So getting the patient's hands into their record. So I have come from many different, I have worn many different hats. Used to be an HIM director, and one of the biggest issues was trying to keep the record away from the patient until HIPAA came. And then HIPAA opened the doors and said, hey, the need to know. You need to know about your record. You need to see it. But you can't see everything. So I'm sitting in a meeting today, and they're talking about, what's the name of the darn thing? Something chat. Source chat or something. It's a new application that just came available with Epic's new 2016 version of software. And it allows you to just go out there and go crazy. It's like doing all the sticky note stuff in the manual world. You can just do that out there, and I'm sitting there going, that HIM life that I lived is being blown up. So there's an opportunity to enter a lot of that information into the electronic medical record. And I asked the question because I've also been subpoenaed by many of the criminal cases that we've had with BJC, where I've had to go defend the electronic medical record and looking at it from a compliance side. So there's a lot that goes into the patient portal that, just looking at from patient portal, unless you do some investigation, it's kind of an interesting area. It touches a lot of different areas of aspects. So those are just some examples that we work on here at BJC, and could hook you into